today we are going to cover the second half of chapter 36 on eye disorders. This is going to cover pages 460 to 469. Remember, there are two different types of macular degeneration, wet and dry. Dry macular degeneration can be treated with high doses of vitamin supplementation, including vitamin C, E, beta-carotene, zinc, and copper. Treatment for wet macular degeneration may include the use of low vision aids like large print books and clocks, laser therapy, which destroys or limits abnormal blood vessel growth, limits further vision loss, or limits the rate of progression. There are two types of laser therapy: thermal laser photocoagulation and photodynamic therapy. To use photodynamic therapy, you must have specific features that are identifiable with fluorescein angiography and a physical exam. Low vision aids include things like large print books, large numbered telephones, large numbered watches, large numbered clocks or thermometers, closed circuit televisions, electronic talking devices, computer devices that can scan and read texts, color-coded pill boxes, handheld magnifying glasses, light filters to decrease contrast, glare-reducing sunglasses, reflective canes and walkers, and telescopes or binoculars. Diabetic retinopathy is retinal changes due to diabetes. It's one of the most common causes of blindness in older people. People with a history of diabetes, high blood pressure, and high cholesterol for many years are at the greatest risk. Retinal blood vessels are damaged by high blood sugar levels. The first sign is the blood vessels leak blood fluid into the retina. Then blood vessels close, depriving the retina of nutrition and oxygen. Then new blood vessels form, proliferative retinopathy. This leads to blindness due to bleeding, retinal detachment, or glaucoma. Symptoms and diagnosis. Many people may have no symptoms or have gradual vision loss or scattered blind spots. More serious symptoms due to retinal tears or detachment include floaters and flashing lights. Doctors diagnose by examining the retina through a dilated pupil. Macular edema may be visible in the center of the retina, and fluorescent angiogram may be performed. Diabetic retinopathy is treated with laser photocoagulation, which seals abnormal blood vessels, decreases leakage, inhibits new blood vessel formation, and is done periodically over years. Vitrectomy, which clears the viscous gel of any blood that has leaked into it, and retinal reattachment surgery for severe cases. Remember, people with a history of diabetes, high blood pressure, high cholesterol for many years are at greater risk. Controlling the blood sugar and cholesterol is key, and annual eye exams for detection is very important. The eye is extremely sensitive to disruption of blood supply. This disruption becomes more common as we age. It is partially due to atherosclerosis. Less common causes may include vascularitis, infection, radiation damage, or injury. Usually the vision loss is in one eye. It can be temporary or permanent, sudden or gradual. If it is sudden and temporary, this may indicate impending stroke or permanent blindness. Seek immediate medical attention. Retinal vein disruption is a blockage of the vein that drains the eye. It is most common cause of blood supply disruption in older people, most commonly seen in people with atherosclerosis or glaucoma. Diagnosis is fluorescein angiography, and no treatment has been proven effective. Complications include macular swelling, bleeding into the eye, and glaucoma. Retinal artery disruption is a blockage of the artery that feeds the eye. The most common cause is atherosclerosis or embolus. Less common causes include temporal arteritis, optic nerve inflammation, infection, and clotting disorders. Rarely can glaucoma get severe enough to cause an issue. Diagnosis is via fluorescein angiography or Doppler ultrasound. No treatment has been proven effective. Retinal emboli are blood clots that break off from plaques. They usually arise from the chest or neck, but they can come from the heart. They cause sudden temporary loss of vision that can become permanent. People have described the symptoms as a slow dimming or a window shade being drawn. If the emboli lodges in the brain, vision loss can be accompanied by speech loss or extremity weakness. If these symptoms last longer than a day, it is indicative of a stroke. Ultrasound and MR are used to find the source of the emboli. ECC and heart rhythm recordings are used to determine if there is future risk for emboli. Emboli are treated with carotid endarterectomy if it originated in the neck and if there is significant arterial narrowing. Anticoagulants such as aspirin or warfarin may be used if it originated in the heart. It is important to treat the atherosclerosis as well. Ischemic optic neuropathy is sudden painless loss of vision due to insufficient blood flow to the optic nerve. The cause is unknown. Temporal arthritis is a treatable form. Vision loss, headache, scalp tenderness, jaw pain while chewing, or fever are all symptoms. Control of atherosclerotic risk factors may help with prevention. Occipital lobe stroke involves the loss of blood flow to the part of the brain that receives images from the eye. Generally, 50% or less of the area of vision is impaired. Diagnosis and treatment for occipital lobe stroke is the same as with any other stroke. A retinal tear is an irregular shaped break in the retina, while a retinal detachment is a separation of the retina from the eye wall and the supporting tissue partially due to atherosclerosis. Retinal tears and detachments occur when the vitreous humor pulls away from the retina of the eye. This separation is normal with age. When adhesions occur, the natural pulling away can cause tears that allow the fluid to leak through, causing retinal detachment. This leads to partial or complete vision loss. Diagnosis is via an eye exam or ultrasound. Treatment is surgery, which includes injecting a gas bubble into the eye, laser therapy, or vitrectomy. Tear production decreases with age. Climate change and smoking may worsen dry eyes. The most common cause of dry eye in the elderly is drugs. Less common causes are infection and vitamin A deficiency, Sojourner syndrome, and treatment is artificial tears. Excessive tearing can be caused by impaired drainage, dry eye reflex, improper lower lid placement, and drainage duct obstruction. Treatment is for the underlying conditions. There are also many eyelid disorders to take into consideration. Ectopion, where the lower eyelid grows lax and droops, and the lower edges may become everted. Entropion, where the lower eyelid turns inward. Ptosis, which can be caused by paralysis of the nerve to the upper eyelid, or a neurological syndrome such as Horner syndrome, or even surgeries. Blepharitis, which is inflammation of the edges of the eyelids. Blephaspasms, which are involuntary blinking or closure of the eye. These are due to spasms of the muscles surrounding the eye. Chalazion, which is swelling of the oil glands in the eyelid, usually due to a blocked duct. Sty, which is infection of the eyelid glands, and these are difficult to differentiate from chalazions. And exhalescence, which are fatty growths of tissue deposits on the eyelids. Thank you, everybody, for your time. Good luck on your quiz and enjoy the rest of your day.